Today, we're delving into a challenging but incredibly important topic. The 20 most painful conditions that people can suffer from, according to the National Health Service here in the UK. Hello everyone and welcome back to the channel. We're continuing our exploration into the realities of chronic and severe pain. The NHS plays a vital role not only in treating these conditions but also in understanding their impact on individuals' lives. This isn't about sensationalizing suffering. It's about shedding light on the realities faced by millions, fostering empathy, and hopefully providing valuable information and resources. Over the next 10 minutes, we'll explore these conditions in a little more depth, touching upon the specific nature of the pain, the underlying mechanisms, and the broader impact on those affected. It's important to remember that everyone's experience with pain is unique, and the severity can vary greatly. This video is intended for informational purposes and should not be taken as medical advice. If you are experiencing persistent pain, please consult with your healthcare provider. Let's begin discussing these conditions based on common causes of severe pain reported by the NHS. We'll present them in no particular order of severity, as pain is a deeply personal experience. And as always, seek professional medical advice. 1. Trigeminal neuralgia. Intense sudden attacks of severe stabbing or electric shock-like pain in one side of the face, often triggered by light touch, chewing, or even a breeze. Usually caused by pressure on the trigeminal nerve, which carries sensation from the face to the brain. This can lead to social isolation due to fear of triggering attacks, difficulty eating and speaking, and significant anxiety. 2. Complex regional pain syndrome, CRPS. Persistent, severe, burning pain, often in an arm or leg, that is disproportionate to the initial injury. This can be accompanied by extreme sensitivity to touch, swelling, and changes in skin color and temperature. The exact cause isn't fully understood, but is thought to involve a malfunction in the nervous system's pain signaling. This can severely limit mobility, making everyday tasks incredibly difficult and impacting mental health significantly. 3. Shingles, postherpetic neuralgia. Lingering nerve pain that can persist for months or even years after a shingles rash has cleared. Often described as burning, aching, or shooting, caused by damage to the nerves from the varicella-zoster virus, the same virus that causes chickenpox. This can interfere with sleep, daily activities, and overall quality of life, sometimes leading to depression. 4. Sciatica. Radiating pain that travels from the lower back down through the buttock and leg, often reaching the foot and toes. Can be accompanied by numbness, tingling, or weakness, typically caused by compression or irritation of the sciatic nerve, often due to a slipped disc or spinal stenosis. This can significantly limit mobility, making walking, sitting, and standing painful. 5. Arthritis, osteoarthritis, and rheumatoid arthritis. Chronic joint pain, stiffness, and swelling. Osteoarthritis is often described as a deep ache, while rheumatoid arthritis can involve throbbing and inflammation. Osteoarthritis is due to the breakdown of cartilage in joints, while rheumatoid arthritis is an autoimmune disease causing inflammation of the joint lining. This can lead to significant disability, affecting mobility, fine motor skills, and causing fatigue. 6. Migraines. Severe, throbbing headaches, often on one side of the head, frequently accompanied by nausea, vomiting, and extreme sensitivity to light and sound. The exact cause is complex and not fully understood, involving changes in brain chemicals, nerves, and blood vessels. This can be debilitating, forcing individuals to lie down in a dark, quiet room, significantly impacting work, social life, and daily routines. 7. Cluster headaches. Intense, burning, or piercing pain concentrated around one eye, often accompanied by a watery eye, runny nose, and restlessness. Occur in cyclical patterns or clusters. The exact cause is unknown, but it's thought to involve the hypothalamus, a region in the brain. These headaches can be so severe that they are sometimes referred to as suicide headaches due to the intensity of the pain. 8. Fibromyalgia. Widespread musculoskeletal pain accompanied by fatigue, sleep problems, memory issues, and mood disturbances. Often described as a deep aching, burning, or throbbing pain. The exact cause is unknown, but it's believed to involve changes in how the brain and spinal cord process pain signals. It can significantly impact all aspects of life, making it difficult to work, socialize, and perform daily tasks. 9. Endometriosis. Chronic pelvic pain, often associated with menstruation, but can occur at other times. Can range from a dull ache to sharp stabbing pain. Occurs when tissue similar to the lining of the uterus grows outside the uterus, causing inflammation and scar tissue. This can lead to infertility, fatigue, bowel and bladder problems, and significant emotional distress. 10. Interstitial cystitis, painful bladder syndrome. Chronic pelvic pain, often described as burning, aching, or pressure, associated with frequent and urgent urination. The exact cause is unknown, but may involve damage to the bladder lining. This can severely impact daily life due to constant pain and the need to urinate frequently, affecting work, sleep, and social activities. 11. Back pain, chronic. Persistent pain in the back that lasts for 3 months or longer. This can range from a dull ache to sharp shooting pain. It can have various causes, including muscle strains, disc problems, arthritis, and nerve compression. This is a leading cause of disability worldwide, significantly impacting mobility, work capacity, and quality of life. 12. Neck pain, chronic. Persistent pain in the neck that lasts for 3 months or longer. Can be accompanied by stiffness, headache, and pain radiating into the shoulders and arms. Similar to back pain, can be caused by muscle strains, disc problems, arthritis, and nerve compression. This can limit head movement, affect posture, and interfere with daily activities and sleep. 13. Diabetic neuropathy. A nerve damage caused by high blood sugar levels in people with diabetes. Often affects the feet and legs, causing burning, tingling, numbness, or sharp pain. Caused by a prolonged high blood sugar which damages nerves. This can lead to foot ulcers, infections, and even amputation if not managed properly. The pain itself can be debilitating. 14. Pancreatitis, chronic. A persistent abdominal pain, often described as a dull ache that may radiate to the back. Can be accompanied by nausea, vomiting, and weight loss. Caused by the long-term inflammation of the pancreas, often due to excessive alcohol consumption or gallstones. This can lead to digestive problems, malnutrition, and an increased risk of pancreatic cancer. 15. Gallstones, acute attacks. The sudden intense pain in the upper right abdomen that can last from a few minutes to several hours, often described as sharp or cramping. This occurs when gallstones block the bile duct. While the pain is usually temporary, recurrent attacks can significantly disrupt life and may require surgery. 16. Kidney stones, passing. The severe cramping pain in the side and back that often radiates to the groin. It can come in waves and is often accompanied by nausea, vomiting, and blood in the urine. This occurs when mineral deposits form in the kidneys and pass through the urinary tract. The pain can be excruciating and often requires strong pain medication. 17. Gout. The sudden, severe pain, redness, and swelling in a joint, most often the big toe, often caused by a buildup of uric acid crystals in the joints. This could lead to acute attacks which can be intensely painful, and chronic gout can lead to joint damage and disability. 18. Inflammatory bowel disease, IBD, Crohn's disease, and ulcerative colitis. The abdominal pain and cramping are common symptoms, along with diarrhea, bleeding, and weight loss. The pain can vary in intensity and location depending on the affected area of the digestive tract. These are autoimmune conditions that cause chronic inflammation of the digestive tract. This can significantly impact daily life due to pain, frequent bowel movements, fatigue, and the need for ongoing medical management. 19. Cancer pain. The pain associated with cancer can vary greatly depending on the type, location, and stage of the disease. It can be a dull ache, sharp, or burning sensation. This could be caused by the tumor pressing on nerves or organs, the cancer spreading to bones, or as a side effect of cancer treatment. It can significantly impact quality of life, sleep, appetite, and emotional well-being. Effective pain management is a crucial part of cancer care. 20. Phantom limb pain. The pain felt in a limb that has been amputated, often described as burning, tingling, itching, or a squeezing sensation. The exact cause is not fully understood, but is thought to involve the brain misinterpreting nerve signals. This can be chronic and debilitating, interfering with prosthetic use and overall quality of life. Conclusion. So these are 20 examples that highlight the diverse and often debilitating nature of severe pain, as recognized by the NHS. We've touched upon the specific characteristics of the pain, the underlying causes, and the broader impact these conditions can have on individuals' lives. It's a stark reminder of the challenges faced by so many in our society. Living with chronic pain can have a profound impact, not just physically, but also emotionally and socially. It's crucial that we foster greater understanding and empathy for those living with these conditions. If you or someone you know is struggling with persistent pain, please remember that help is available. The NHS offers a range of resources and treatments, and your GP is the best first point of contact. We hope this video has provided some valuable insight into these challenging conditions. If you found this information helpful, please like this video and consider subscribing for more educational content. Let us know in the comments if there are other health topics you'd like us to explore. Thank you for watching. Take care, and we'll see you in the next video.